That's Med-Surg, right? Welcome to Med-Surg. Neuro will take me 2 to 3 weeks. It's like cardio. It's very intense. It's a lot, and NCLEX asks a lot. What disease are in neuro? MS, Parkinson, spinal cord injury, seizures, Mastinius Gravis, tic douloureux. All of those diseases are in neuro. Okay? Ready? Page 838. The first drug in neuro is drugs that we treat Mastinius Gravis with. But first, before I even get into the drugs, let me explain to you what is Mastinius Gravis so you will understand the drug. It is called anti-Mastinic medication, or another name for the drug is called anti-cholinerase. Miss Sonia, what is Mastinius Gravis? Well, this is your neurons. Your neurons send message to the brain and spinal cord to the brain. What do you mean? I put my hand on a hot stove. The reason I pull my hand off because there's a message that went to the brain saying that the stove is hot, right? So that's the job of the neurons. The neurons has to lock together. The neurons are locked, not covered. What the neuron is covered with is what we call myelin sheet. M'a découvri. My thing is what locks the neuron. Lock. What locks the neuron is what we call chlorinase. Chlorinase. So when the patient have Mastinius Gravis, it is a muscle weakness from head to chest due to the problem with chlorinase, right? So we have to give this patient anti-chlorinase. There are 3 drugs that NCLEX asks you about. Tensilon, Mastinius, Prostagerman. It is on page 839. Mastinius, Tensilon, Prostagerman. These drugs, you cannot give it too early, too late. You cannot give too much and too little. Again, this drug, you cannot give them too early, too late, too small, or too little. If you give too little, the patient go into a crisis called Mastinius crisis. If you give too much, the patient go to a crisis called cholinergic crisis. The antidote, if you give too much, is called atropine sulfate. When you give too little drug, the patient vitals all go up. High blood pressure, high everything, but respiration go low. When you give too little, when you give too little, everything go up, right? Everything go up. When you give too much, everything go low including respiratory, which is cholinergic crisis, and the patient dies. So when NCLEX asks you which patient you're going to see first, the Mastinius Gravis patient, not because of the disease, but the what? Medication. The medication is given with food. Okay? With food. Any question with Mastinius Gravis medication? It's on box 57-1. You need to know tensilon, mestinon, prostaglandin. Cholinergic crisis is when you give too much. The antidote is atropine. Écrit ça pour moi. In my class, boxes are très, très important. Boxes. Boxes. Then we go into Parkinson disease. Parkinson, right? The patient have what? How's the dopamine? Too what? Too low dopamine. The patient have low dopamine, so you give Parkinson medication. The Parkinson medication is box 57-3. I need you to write yourself a note. I cannot go to NCLEX without knowing the what? The Parkinson drugs. I'm going to give you the list of drugs. Listen, when I do the class, I say one drug. You need to know both drugs. Ready? Amantadine, Simatrel, Cinemet, Carbidopa, Levodopa, Mirapex, Requip, Cogentin. Where you should have seat, mommy. You don't have a seat? Right here. Right there. Guys, you gotta do not put stuff on the chair. It is a busy place. People gotta sit. Please put your things under the chair. No one should stand. I cannot take no more people in the morning. Everybody, you want a friend want to come at night. Okay? Please. The seats, no one should be standing right here. Okay? Okay? Then we go into Cogentin. Cogentin is the antidote for Haldol. We also use it for Parkinson. Right? Cogentin, Parkinson. NCLEX, sometimes don't put Cogentin, no. You mette COMT inhibitors. Dégagez-nous. NCLEX can put brand, generic, or class. NCLEX can put brand, generic, or class. Now, sign and symptoms. The drugs, meaning, guys, when NCLEX asks you questions, they can ask you questions on the sign and symptoms of the disease or sign and symptom of drugs. They can ask you teaching on sign and symptom of the disease or teaching on drugs. You need to know everything. We only doing drugs right now. When we do the disease, then we're going to put the disease and the drugs together. That is med-surg. You cannot go to NCLEX and do disease. You don't do medication. And I do the class, medication separate, and the disease separate. Your job is to study it together. Parkinson. This is the disease. This is the sign and symptom of Parkinson. This is the drugs. This is the sign and symptom of the drug. That's how I send you to study. I didn't send you go study separate. I have to teach it separate, but I didn't send you to study it separate. You cannot do med surg if you didn't do drugs. You got to do them together. It sticks better. Ready? Let's go. Sign and symptoms of the drugs. Miss Sonia, so dit la madame. What I told you is, les patients prennent médicaments yo. Mais ça wa pou nan patient. M'pa djou les patients gen disease la. M'pon ko rive nan disease la avant, nan médicament. So, when the patient take this medication, what do I see? Ready? Let's go. Dyskinesia. Listen, the disease causes involuntary movement. The medication causes involuntary movement. That's why people with Parkinson say, I'm going to die with Parkinson before I take that stupid medication. The medication causes bradykinesia, dyskinesia, involuntary body movement, chest pain, nausea and vomiting. Whoa, this is why you give it with food. Because it causes not. Now, NCLEX ain't going to put nausea and vomiting. You make the GI problem. C'est pas même anglais à vous mettez là. NCLEX put regurgitation. C'est vomir. You cannot say, well, the book didn't say GI problem. Hell, the book say nausea and vomiting. You must understand that nausea and vomiting is what? Okay. Vomiting. Okay? Urinary retention. Yes, it make them cannot pee. Constipation. More constipation. The drug make the patient constipated. So NCLEX say, which teaching you gonna do to a Parkinson patient? You may give fiber or backline. Boy, it's the drug that cause constipation. So yes, Mikey need to take fluid, and Mikey need to take food with fiber. Qui long, qui anglais. What more can the people give you? You see? But we ain't get to the disease yet. Hold up. We only doing what? Medication. So right there, medication cause GI problem. Medication cause constipation. You see where I'm going with you? Okay, Mr. Mikey, make sure you take fluid. Teaching. Eat food high in fiber. Teaching. You see that? Okay? Continuing. Sleep disturbance. The disease causes sleep disturbance, and the medication causes sleep disturbance. That's why NCLEX asks you, what do you do for a Parkinson patient? Lock the door. The students never take it. Why? The medication make the patient hallucinate, look like you schizophrenia. That's why Parkinson patient, you put them here, you find them all the way in Jog Road naked. One day old, so at night they have sundowners anyway. Boy, they on these drugs that make them cuckoo-luku. They can easily pull a knife on you. They can easily leave. So Parkinson patient, lock the door. The students say, why lock the door, Parkinson patient? Because you forgot the drug caused them to what? Yes.
Oh, that happened last night to a patient.
That's right.
Now that you're saying that.
Parkinson patient, you should lock the door. Not for Parkinson disease. For the what? Yes, darling.
With the retention and constipation, I mean, you said you have to push fluid. I mean, wouldn't there be a problem with pushing fluid in the...
Urinary retention mean cannot go. So Simba cannot go. What bum blow kisa? Simba kapupu. What bum blow bagay kisa? That's why. If they're constipated, you need to give them fluid to help it come out. You got it? Guys, do you see where the question, you see where the people could go with you deep in the ocean? So if you don't understand, you in trouble. always, you got to understand not only the disease, you got to understand the medication. You got it? Okay, continue. Orthostatic hypotension. Yes, confusion. Okay, the patient on Symmetrel. The patient say, where am I? Who are you? Who the hell are you? You gonna call the doctor. It is understood that when a patient has Parkinson, they take Parkinson medication, they will be confused. Why you go call doctor? Oh, medical emergency. Y'all will take it. Y'all laughing, but this is what students do. Right? It is understood anytime I have Parkinson, the medication make me blue. I'm not schizophrenic, the medication. And the medication makes them beat worse, where you shake, where the disease make them shake, and you see the medication make them shake. You're like, damn, Bob, what's wrong? Right? So make sure we know that. Mood change. One day they happy, one day they cry. Hallucinate. Dry mouth. Boy, they go, GI problem. Dry mouth. GI problem. Nausea and vomiting. You see that, guys? So anytime a patient have Parkinson, you want to give them ice chip. It's go work exio. The people go deep. Okay? We cool? Now, intervention. Before I give this medication, I'm going to take your vitals because I know the medication causes you to have hypotension. You see that? There you go. Risk for injury because the medication make you what? Shake. Do y'all see where the question can come? I didn't even go to the disease yet. Only the what? Drugs. Right? Instruct the client to take medication with food because they're going to have nausea and vomiting. VLA. Right? Monitor for dyskinesia. Monitor sign and symptom. Monitor for improvement of signs and symptoms of Parkinsonian. Right? Instruct the client to change position slowly because of the disease. Yes. Do not stop the medication abruptly. Taper. So they go NCLEX. Which one needs further teaching? When the patient say, I feel better, I'm going to stop taking my medication. They need what? I know my stuff. Oh, I know my stuff. But you went and failed. You ain't know your stuff. You need to read the book, right? Go down. Advise the client with diabetes that the glucose testing should not be done through urine testing. Let me explain something to you. When you are taking Parkinson drugs or Cinemet, levodopa, it always make your pee orange. Not only your pee, your eye, your tears. Even when you blow your nose, you see it's kind of orange. It's normal. Only Cinemet, only levodopa, cardopa, Cinemet, not all of them. Now, when you have diabetes, and you also, yes. You cannot hear. Why can you not hear? Oh, because the way I move, I only go, maybe I like them better. Ooh, no, because the sun is lighter. All right, let's go. I'll try to give this side. So anyways, go with me on K. You see where K? Go K, page 840K. That is K. I said, do not stop it abruptly. You with me? Okay, then I went to K. Oh, no, hold on, K, about making your urine turn color. Now, I'm going to talk about the alcohol last, and I'm going to tell you why. Okay? Advise the client with diabetes that glucose testing should not be done through urine testing because the result will not be reliable. Okay. When you take a certain medication, antibiotic, Parkinson, you know how you check your glucose, you could check it urine and you could check it blood. So if I want to check your sugar, and you're a Parkinson patient, I will never check your urine because I will automatically see your sugar high, and that don't mean you're diabetic. It's the drug. It's the drug. Donc, patient qui gagne ni Parkinson, ni diabetic. Si vous voulez checker cycle, m'a jamais use pipi. Parce que l'a toujours montré cycle là, ou nan qui ça? Nan pipi. We got it, English people. I hear it, right? Okay. Now, we good? And, Meli, levodopa, cinnamon. You eat it to eat low protein food because high protein food will interfere with the medication. They go like this, NCLEX from the back. The patient is on levodopa. Which food would you question? Boy, the food that have what? There you go. The patient is on cinnamon, levodopa, cardopa. Which lab you will check? Liver. Why? Who break protein? NCLEX question. You better know it. You see how they flip it on you guys. Make sure we know that. So then you say, oh, Miss Sonia, the test was fundamental because they asked you a diet. I teach the food in fundamental, but I just told you, patients who's taking Parkinson drugs, you gotta watch high protein. And let me tell you, see how the books say levodopa, cardopa? NCLEX ain't gonna put levodopa, they gonna put Parkinson drugs. If you want that. So you gotta remember, the critical thinking still remains. They don't have to put cardopa, levodopa. If they put Parkinson, it's understood that you know what they're talking about. You got it? Yes. Cibotril, right, which is the same it's not a C2. Cibotril is amantadine. Cibotril is not a C2. Cibotril, the facility counted as C3. I'm going to tell you why, because they use it for flu. Amantadine, Cibotril have a lot of side effects. That's why they consider it as C3. For the côté, no, it's not really a narcotic for the côté because it causes a lot of side effects. It's not only used for Parkinson. That's why when you taking amantadine, Cibotril, you gotta ask the patient, why are you taking this? Because we also give it for flu. It's like Tamiflu. Remember we did respiratory influenza? I taught you that.
Yes.
So amantadine, Cibotril is not only used for Parkinson's. It's used for flu too.
Is it the same thing like loratadine?
Huh?
Loratadine, but the same.
Yes. The other name, it has like, it goes up Norway. I forgot the class they call it. But it is used for both Parkinson, yes, and flu, and some other things too. When the patient have muscle spasm, they normally give it to them. Okay? Any questions? Right? Okay. Now, then we will go into seizure medication. Be careful with seizure medication. I don't want you to know everything. I'm going to give you the meat and the potatoes. Let's talk. The first seizure drug you must know is called Dilantin. RN, this is for you. Dilantin, when you give it IV, because, hey, Dilantin, you can give it IV, RN. You must get it witnessed. When you give Dilantin IV, I didn't say PO, IV, you must watch the patient for compartment syndrome. Dilantin can cause the patient lose the arm. Why? Créole, l'homme médicament, IV, médicament coulé. Sous Dilantin coulé, dans IV à la manger, plastique là, et puis tout manger, eat up the patient arm. English, only IV. When you give Dilantin IV RN, you must get it witnessed. It causes extravasation. Extravasation is cause the medication to leak, which the patient at risk for compartment syndrome. IV. PO Dilantin, you don't need a witness. But you need to teach me hyperplasia. Tell me to make sure I go to the dentist because Dilantin causes the gum to swell. Dilantin. All seizure medication. All seizure medication. Dilantin, Tegretol, valproic acid. Your tooth, all of them cause something called blood disgraces. Miss Sonia, what does that mean? All seizure medication cause low WBC, low platelet. That's why you must isolate the patient that is on seizure medication. So they go NCLEX. You got one empty room. Which patient you gonna put in it? You never take the seizure patient. You know why? Not because of the seizure, but the what? The medication. All seizure medication cause low platelet, low WBC. So I'm on seizure med. You must teach me, wash my hand. Take me out of the room with someone that immune low. You never take that. Okay? Teach the patient about bleeding. Watch IV, putting IV in them. Watch giving them the rectal tap back because their platelet is low. Their WBC is low. That goes for all what? Okay. Any question? The name for Dilantin is called Hadaltones. Hadaltones, Hydentones. In NCLEX, sometimes you'll put Hadaltone, you'll final. Hadaltone. Bottom. Right here, 57.5. No, that Fenitin, that's brand and generic. I didn't go there with you, I went class. Ooh, we know class, we know brand and generic. NCLEX, by Monday, brand generic on call. They give you class. How the tone, you'll be not involved. Right here, Hydanatone, box 57, that Panafel Glemlone, right here. The box 57-5. Why don't on the top? No, it's box 57-5 on the top. The class. Guys, there's brand, generic, Panaptim, Fentanyl. Boy, that's when I took my NCLEX, baby. They don't give you that no more. They give you class. Right? Like singular, Leukotrins. They, of course, you are in, you must know. Right? Haldetones, Dilantin. Right? Make sure we know that. Now, anytime you are taking Dilantin, Fentanyl, Haldetone, anytime you say, I can't walk, or the patient get up and fall, that's a big adverse effect. The doctor must take the patient off the medication. So anytime you special Mr. Dilantin, you must watch the patient gait. Okay? Any question? Gait. Now, the PAMs, lorazepam, diazepam, pam. We call those benzos. That's the class. What? Benzos. Ativan, diazepam. Now, the PAM are given for seizure, but it's the seizure that don't want to stop. They call it status epilepticus. The one that you keep getting every 5 minutes, keep having. That's when they give PAM. When do you have that type of seizure? Alcohol withdrawal. Anytime a patient drank and you stop drinking, you start having those seizures, I will never give you Dilantin. I will give you a PAM. And it is diazepam. Again, benzos are used for anxiety. Benzos are sometimes used for allergy. Benzos are used for seizure. But let me tell you what seizure. The seizure that you normally get after you stop drinking. You going through alcohol withdrawal. Any questions? I say Pamio. That I'm on box 841. So again, when you're doing the drug, you need to know brand, generic, and class. Benzos are the class. The one is in the parentheses is the brand. The one without the parentheses is the generic. Qu'on a fort bien. NCLEX can give you 1, 2, or bon class là. And you on the go. You nerves. Yeah, of course. Turn. Then we go to box 57-8, and the class is called Systemides. These are the drug. This is the drug we give for petite mild seizure, epilepsy, which is called Zorantin. Zarontin. It is called ethoxamide. Zorantin. Zorantin. You see it? Box 57A. We give that to children. Hardly ever you will see adults on Zorantin. You will only see adult on Zorantin if they're allergic to Dilantin. You will never see doctor give kids Dilantin. Too strong. The strongest seizure med they will give to children, valproic acid. But kids, epilepsy. Remember, seizure, gun mal is this, Dilantin. Petite mal is this. You don't give me Dilantin for staring. You give me Zorantin. That is called epilepsy. So if you know what epilepsy, that is what? Seizure, petite mal seizure. Okay? Valproic acid, 5710. Dapakine, Dapacote, Valpro. What's that on your bowel? Your final. And A, box 57-9. Those are old drugs, but hey, NCLEX don't like to give you these long names. They give you the class. Oxalazolidine young. And the students get up and run the way. I never did that. Yes, you did do it. Guys, I'm going to tell you, if you don't take this serious and think you just going to skim through shit, you going to fail. I'm telling you, there's no easy way out. You got to read this book and you got to understand it. If you skim, I got this. I speak good-ass English, you will fail. I promise you that. No, because I don't want you to know that. Valproic, Dapakine, Dapacote. I don't want you to know that. because I talk about that in alcohol psych. You got it? I need you to read the book on the series. Don't skim. I have 2 students that went with a whole lot of English, failed. Skim. I skim, I got this. No, you don't. You got to read and open the book. And some of you guys who in here went and failed, after today, my lecture, I guarantee you know why you failed. You did not understand the disease. And if I take you in the office and give you a test, I guarantee you, you will fail it. A student cannot fool me. I know when a student go on, when a student don't. All that damn English will not faze me a bit. You the main one that can't pass. The one with the good ass English. And I was one with a good ass English. I thought I knew. Teacher palavra. I kept failing the damn test. Soon as I shut and read, I was like, oh, I got this. It's not about English. The people that come up here don't speak no damn English. When they talking to you to tell you how they pass, I do the translation for them. So how did they pass? Comprendre. It has nothing to do with English. Take your English, stick it under the bed. Bring out the common sense. That's what passed the test. Okay? Let's go. Box 5711. You're going to put, I cannot walk in NCLEX without that box. You need every drug in that box. You need box 5711. And I'm going to tell you what they are, and I'm going to go slow because you need all of them. Tegretol. Tegretol is a seizure drug. But we use this drug. These drugs not only used for seizure. Boom. Tegretol is the #1 drug used for tic douloureux. The tic douloureux, the one with the facial pain. Tegretol. These drugs in 57-11 are not only used for seizures. They use for other things. There's another drug. I want you to write, oh, it's in there. Lyrica. We're going to talk about that. Not Lyrica used for seizures, but it also used for what? Pain, Malaysia. So anytime a patient tell you they on these drugs, you're going to say, why are you taking them? Because they use for multiple use. MS, multiple sclerosis, Guillain-Barré, you'll use you. Okay? Lyrica. So we're going to go down the list. Neurontin, whoa. Lamictal. Lamictal not only used for this, but it's also used for depression. You see a patient want to commit suicide, after you have a baby, you know how you go to postpartum blue, psychosis, you start killing people, they give you Lamictal. It's in the same category as Abilify. Okay? Another psych drug that's supposed to be here. It's not, it is called Cebalta. Cebalta is a depression drug, a TCA, but it also used for pain, Malaysia. Moun ki get diabetes, ki pa ka move, no, peripheral neuropathy, you use Cebalta. This is how you spell Cebalta. Okay, H. But it's not on there, but NCLEX Moduli, Cebalta. Fall here. Okay, Keppra, Trilepto, Lyrica, Tagabine. This is an old drug, but NCLEX ask it. Tagabine. Topomac. Let me tell you who used Topomac. Hey, you know when you have breast cancer, and they do a mastectomy, now the lady cannot move her hand, they give Topomax. So not only it's used for seizure, it's used for peripheral what? Neuropathy. When the patient say, I cannot feel my what? Leg. Comprendre. See, these drugs got multiple use. Okay? Hey, Sabro, you see the Sabro? Hey, NCLEX don't give you, they say vagabatrin. Students don't live ain't cool because it's a big word. Don't get intimidated. Know your drugs. And look, just because I just did it with you now, it stick today. But if you don't go repeat it again, it's gone under the bed. So can I say you didn't study? You did study, but you didn't rekisa. You didn't revise. If you don't revise, you will fail 10 times to the exponent plus the exponent and the exponent. You got to revise. I'm not a negative person, but yes I am, to students who don't study. Okay? Then we go to amphetamines. 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 Diet pills. Diet pills. Amphetamines, weight loss. Right? These make you weight loss. Now, amphetamines is coffee. Coffee make you what? Shake, jittery, heart rate is up. Like coffee. So let's talk about them. Amphetamine, right? Adderall, Dexedrine, Ritalin, Focalin, drugs, ADHD. So students say, oh, Miss Sonia, is it something they can give me pour penser, hell, study, right? Focalin, I want you to add it to this list. Concerta, right? Concerta, Focalin, Concerta, Adderall, Ritalin, Dexedrine. These drugs are given with breakfast, not in the morning. NCLEX say in the morning you take it with food. Why? Because if you take it, you did not eat, it make you lose weight. That's why when you give it to kids, you give it with food and you sprinkle it in the food. These drugs come in capsules because kids don't take what? Pills. If you take it before you eat, you will never want to eat. That's why anytime you take this drug, you got to weigh them and you got to put them on the little scale because it slows their what? Their growth. You give this ADHD kids and you also give people who want to lose weight. You know quick weight loss center? That's what them pills are. Yeah. Make you faint. I was on it. Honey, I faint in the bank. My mom said, oh, I actually faint in the bank. I tried every diet, and that's what quick weight loss. I lost 75 pounds, but I almost died. It made me, ooh, I was yeah, it's good. It's the best. But right? Huh? Oh no, it come with pills. They don't even got name on them. Yeah, Finch or something. It don't even. They sometimes call them anorexia, but the amphetamines they like coffee, make you. And at Nova, I'm gonna tell you, at colleges, universities, this is heaven. Ooh, imagine you drinking coffee and you go to Miami and some Cuban sell you this. My partner, my study partner, Nadia, was on there. I said, girl, what's wrong with you? I said, that's what no good. I'm telling you, but you focus. You like this. You want to test and I'm going to tell you, no joke, I have a Jamaican student that went to take NCLEX and she took Xanax, I swear to you. And she don't overget. She said, Miss Sonia, when I got there, I stood just like that. I said, what are you thinking? She said, yeah, I kept clicking, but I stayed just like, I said, And she fell, she said, never. Tell the student, never take Xanax to go to NCLEX. Nothing. Because she went like this. I said, what was your number one question? So don't do it. Okay? So amphetamines is like coffee. Coffee. Then we go to anorexics. Now these are the weight loss pills. Now here it is. Dendrex. I want you to focus on the Xenical. The Xenical now is over the counter. And it is called Ally. Xenical, Ally, when you take it, baby, and you wear white pants, you see all the fat. Don't see, even like wet breasts, you see it. All the patients sweat, you'll see it. Xenical used to be prescription, but it's not over the counter. They changed the name to Ally. But your heart beats so fast, but you do lose weight, about 20 pounds. But it's good, but you can't wear it. Go white. Xenical, it's good. Bontrail, Adipex is good. It's the best now in the market, but Adipex make you high blood pressure. And the last one, Meridia, which United States don't have. Canada. I have a friend that died of this. She was married to a doctor and she died. And he was under investigation because they thought he wrote it. But guess what? She got it from Canada. Meridia, you will die. You will wake up dead. You won't wake up, yeah. Meridia, it's very good, but to move. Meridia. I told you she's a nurse. She just died. Okay? Yeah, she died sex. And he went on and married another nurse. All right, that is. Any question? Make sure you know that. Okay, so turn. I'm trying to get this. I want to get through this. That's why I'm rushing. Okay, our last topic that I want to go into, I want you to go to page 845, and I want you to go to morphine, because I want to talk about morphine. Because morphine has a bad name out there. And I want to help you. I'm on page 845, morphine sulfate. Ready? We're going to read. Listen, morphine causes respiratory depression. Cause. Page 845-4. And it has a diamond. Diamond, Rihanna says, shine bright like a diamond. Diamond is important, right? So morphine causes respiratory depression, orthostatic hypotension, and cause constipation. Guys, they did not say morphine is for diarrhea. Listen, when a patient has diarrhea, because morphine causes constipation, you give morphine. But ain't nobody told you no morphine c'est pour diarrhée.
Not at all.
Comprendre? Now, morphine is for pain. It's an opiate, right? So when you have MI, the first thing you say, chest pain, and the heart is beating fast. The reason I give Mona for MI, morphine, is not for the pain. I give morphine to slow the heart down, which will slow down the pain, which will slow down the respiration. That's why I give morphine for MI. Do you understand, student? Student always say, oh, so if I say the patient got MI, what's priority? The problem with MI, there's no circulation. No circulation causes heart rate going fast. And because of no circulation causes pain. The reason you giving the MI, not for the pain. If I break a leg and you give me morphine, you're going to give me morphine for the pain because it's opiate. For MI, you don't give the morphine for the pain. You give the morphine to slow down the heart, which will slow down the pain, which will slow down the respiration. Any question? Comprendre. Sickle cell patient, you give morphine. Why? Ready? Because the sickle cell, the blood is sickled. So when the blood, listen, goes through the organs, the patient has pain. The patient has sickle cell. Priority is not the pain. Priority is the fluid, because it's the fluid clotting that causing the pain. On NCLEX, they actually priority, you say this with morphine. Why? Comprendre. See, it's the blood that is clot that causes the pain. So you need to fix the first problem first by giving fluid. Then you give pain. But if I ask you what's priority for sickle cell, guess what you're going to say? Pain. There you go again. Organ. Then why not testimonial? Why do you l'école dit? Go comprendre in what you're doing. It's an understanding of what you're doing. Oh, you can give morphine for diarrhea. I understand that. Because one of the side effects of morphine is constipation. Oh, Miss Sonia, then how come the patient in hospice get morphine killing them fast? Wrong. When you are stages of dying, which we will do in psych, you will hear the patient have what we call chin stoke breathing, another name, Kushma. We don't want that. So we give you morphine drip, which will slow down the heart, which will slow down the breathing. Not every dying patient is in pain. Yes, chronic cancer, we give morphine because of the pain. Not every dying VITAS patient get morphine for pain. You get morphine to make the death process slower. So people say, well, morphine no kill the patient faster. No, the patient was already dying, Jan. It helped you go smoother to God. Instead of you going, ha, 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 ha. You see that? Right. You guys have it. Come on, LPN. You have hospice patient. Sometimes you don't even walk in the room. You stand in the whole time. Right? Any question with morphine? D. Go to D, and I want you to put NCLEX. Morphine is contraindicated in severe respiratory problem patient. So, hey, I have COPD. You come give me morphine. What you just did. So, Miss Sonia, I'm trying to make things fun, guys. But honestly, the NCLEX ain't going to ask you the question like, they're going to say, which one would you intervene? What does the patient say? You go interact. Now they don't put question, they don't put intervene. They put interact. Reinforce. Be of presence. Y'all know y'all friend just went. Ask them how they give it. Hawaii is the bum. Boy, y'all in trouble. The one that running to Hawaii. Hawaii ain't playing with you. They going in. Hawaii ain't no joke. Don't run to Hawaii. Run towards the book. Deep in the book. And don't listen to them damn Haitian people tell you nothing. Read your book. Anybody who passed, don't listen to them. I did 50 million questions lie. They read the damn book. You know, Haitians ain't gonna tell you the truth. I'm one. I know how they lie. Don't listen. Read your book. Read your book. That's what's gonna give the license. Don't listen to nothing they say. They'll come to the review and tell you they've never been here. That's why I opened the window so y'all can see everybody. Hey, don't listen to them. Read your book 10 times. Okay? Now, severe respiratory disorder, head injuries. Anytime the patient has ICP, head injury, you cannot give morphine because of ICP. Right? Spinal cord injury, they don't give morphine. They will give them Demerol. Right? And anytime I had spinal fusion, what is spinal fusion? Old student, it's a surgery that we do for little girls that have scoliosis. Spinal cord, you don't give them morphine. Right? Okay, renal, liver. So anytime you give morphine, you got to check the patient BUN creatinine, liver enzyme, kidney, all of that, okay? With shock or blood loss. And listen, anytime a patient too, in hypoxia, they lose blood, you don't give them morphine. Guys, si nou pa li, nou va pran nan ou, li déchire bouk la, déplie main, mette koulè, li 1000 fois. You got to read the book. Tout ti bagay pou li tout kote. Don't leave nothing for tomorrow. Se licence pa chache. Donc, m'kone, tout moun ki kone, retourne sans licence. Read the book. Okay, I'm serious. Any question with morphine, know it. You see, I only went to morphine. Make sure, because they ask. Turn. About 5718 and 5719. Narcan. Student Lunty. Narcan. Miss Sonia, Narcan. Class, let me tell you what Narcan is for. Narcan, the school taught you antagonist for opiate, true? Meaning, when you give too much opiate, you give Narcan. Wrong. Let me explain to you. When you give a lot of opiate, if I remember a lot, any opiate, your respiration goes down. That is why we give Narcan. It's because your respiration low. Narcan job will live their respiration. So if she's in premature labor, baby coming out, baby lung not developed, I can give baby Narcan. Mommy didn't do no opiate because Narcan is not for opiate. It's to bring the respiration up that Narcan can cause. I mean, the opiate can cause. So c'est peut-être ça. Anytime a woman, or if I just woman, premature labor mom, people whose ARDS, acute respiratory distress, nobody need Narcan. You know what the students say? Well, Narcan. She didn't take no opiate, but she got respiratory what? Distress. Let me tell you how Narcan is administered. First of all, who will admit Narcan come in IV, and it also come in PO. In the nursing homes, they will have POs. In nursing home. In drug treatment rehab, they will have PO. In the ER, they will have IV. When you give an IV Narcan, only RN, yes, Ms. Kara.
Maybe if they put their hands up, if they need a receipt, I can just walk around to them.
Yeah. If you went to me, I didn't give you a receipt, she's gonna give you, just raise your hand, so she don't have to call. No, the new people. You remember you came to me, and I didn't give you a receipt, she had them. Okay, so Narcan, the first thing the doctor do, ask you to bolus. Sonia, I need you to bolus the patient. Bolus vle di bon medicament tout vite. English, bolus means rush it. So the patient come in with a respiration of 4. Let's play God here. Nobody can play God, but we gonna try. Her respiration of 4. The first thing the doctor says, Sonia, I need you to bolus the patient. Meaning, you push the Narcan. Push it fast. And anytime you push Narcan, you always push normal saline. Then Narcan has to go on infusion pump. Narcan cannot just be IV push like that. It has to come down, tech, 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 after you bolus the patient. Anytime the patient is on Narcan, listen, your respiration was a 4. I'm giving you this medication, I bolus you to raise the respiratory from 4 to a 12. You can die like a chicken. Tachycardia. You easily can go to VT. So anytime an RN, you giving Narcan, you must put the patient on heart monitor. You must have IV pump. Narcan is not IV push. It is on a pump. Drip. Yes. They call it infusion pump. You must put the patient on heart monitor. You must watch the patient for tachycardia, hypotension. You must have a board in the room just if the patient go into dysrhythmia. You will, when they over here, Miss Karen, raise your hand if you went to me or Christina, raise your hand so she can give you a receipt. Okay? So you must push it with normal saline. You know why you dilute me? It was strong. And guys, Narcan, English, it come in a little bottle so much, honey, so small. When you remove it, you can sometimes lose it. That's how it's a small glass bottle. If you drop it, it'll break. They normally ask you to take it and tape it on top of the bed. Tape it. That's how small it is. RN, IV, you administer Narcan. And as an ER nurse, Saturday night, people do drugs. Anytime I have a Narcan patient, it better be my only patient for that night because the patient can die in your hand. It's every 5 minutes. Hey, Sarah, you okay? Hey, Sarah, yeah, I'm here because the patient. Remember, I'm taking a respiration of 4 and I'm bringing it to a 12. The patient can die. Okay? Any question with Narcan? No, yes. When you bolus it, you IV push it, bolus, and then you run the normal saline, yeah, for dilution. Dilute it. Okay? Now, the last one is mannitol, box 5719. Mannitol, right, y'all see it? That's a diuretic. I teach mannitol in 2 sections. I teach mannitol in, ready? Who can give it to me? Cardio and neuro. And eye and ear. I teach it in 3 places. Cardio, eye and ear, and neuro. Mannitol for neuro is for ICP. There's some pressure. Remember, it's a diuretic. Eye and ear, it's used for glaucoma. Which one? Close, the painful one. And mannitol, it's also used as a diuretic. It's on page 706 in your cardio. It's also used as a diuretic like Lasix, but it's very strong. Anytime you give mannitol, whether it's for ICP, whether it's for eye and ear, whether it's for cardio, you must check potassium. Right? So let's go. Asthmatic. Side effects, fluid and electrolyte imbalance, the potassium, sodium, pulmonary edema, you need to check for fluid, check INO. You must check nausea and vomiting, headache, and, ready? Dehydration. Anytime you give in mannitol, Lasix, all the diuretics, you must check kidney function. All right? Any question? Okay? So let me recap the pages I want you to read. Because I cannot just give you if you not know where to go study. English, I cannot give you and don't send you where to study. We're going to go from back to front. Ready? Page 846, you're going to study box 5718, 5719. Don't say only read the box. No. Read the lecture too that goes with the box. So the student will go, only the box. What? Oh! Why would you ask the teacher that? The lecture, 5718, 5719. Page 846, 5718, 5719. The lecture that goes with it. That's number 7, number 8. You can't just read the green box. The green box only tells you 2 drugs. You got to read. Read. That's our motto for the year. Read. Turn. Morphine. You're going to do morphine sulfate 4. When you see where it says new bang, I talk about that in sight. I don't care for that. I talk about it in sight. Aspirin, box 5716, page 844. I talk about that in eye and ear. And don't tell me you didn't do this. Trust me, I'm going to tell you what you need. That's the same students. You didn't do this. They know NCLEX when you day 0. Always telling you what you didn't do. I'm going to tell you what I know. Anytime I don't do something, it's because I know I'm going to do it at another class. Okay? Page 843. You need to know box 5714, 5713. Box page 842, 5712, 5711, the lectures. Definitely 5711, you know the lectures too. Okay? 842, shh, no, write. Don't talk with your mouth. Just write. 5710, page 842. 578, page 842. Page 841, 57-7. The reason I don't do 57-6 here, because I'm going to do it in psych and alcohol. Seizure medication, I want you to do 57-5. 57-1, when you read Darlington, just know it's a level 10 to 20. When you read the lecture, you're going to see it. Turn to page 839. You're going to do Parkinson, 57-3. 57-2. 57-1, and you're going to do the lecture 838, 839. Those who got your packages late,